Now, with Maharashtra seeing an increase in cases, but overall in India, COVID cases have been going down. They've been in decline. So is the pandemic firmly in retreat, or is it too soon to say that? Currently, if we look around, while we remain home to world's second largest COVID outbreak, life in India is almost back to normal, as I was just discussing there with Dr. Pandit as well. Now, to talk more about the India puzzle, the reasons that we're seeing the cases overall going down, we're joined by Professor Bhramar Mukherjee, a professor of biostatistics and epidemiology at the University of Michigan, who's been also closely tracking the pandemic here in India as well. Thank you so much, Professor Mukherjee, for joining us. So, what is your view on the reasons that that India is seeing cases coming down? There have been so many different theories given. What is yours?
Yeah, I think that's the million-dollar puzzle, Gargi, and I wish I knew the answer. I think there are lots of plausible hypotheses right now, but we need more data to draw any causal conclusions. So I think that some of the hypotheses that have been postulated in terms of cross-immunity, in terms of genetics, in terms of hygiene hypothesis, as well as younger population, they all possibly have contributed to this decline. But I think the most reasonable assumption is that in the metro areas where we have data that the serosurveys show that nearly 1 out of 2 people have been infected, though they were asymptomatic. And this we stated in a paper back in August that most of 98% of India's detected infections are actually the undetected infections. There's a large number of that. And so that saturates the metros. But I am really puzzled about rural India because the serosurveys, statewide serosurveys and national serosurveys also show that the seropositivity or seroprevalence is 10% in some of the remote areas. So why the virus did not spread in the remote areas? And I think the outdoor lifestyle, the aerosol transmission was probably prevented by the outdoor lifestyle of rural India. And there will be other hypotheses as well. So I think that it is a mystery that we are going to dig into for a couple of years to come and even more.
And what's worrying is, like the situation in Kerala right now, in the initial months, the pandemic seemed to have been controlled there. The cases had come down. But once again, in Kerala, it's very high if you compare to other states. So that's one of the areas which is a big worry. What's your view on that?
Yes, I think that, again, we wish that we knew all the answers. But I think that this is a lesson that we cannot really let our guards down. So Kerala did a very good job in terms of controlling the pandemic in the earlier part. But again, it's human nature, and it's also the nature of policymakers and the whole system that we let our guards down. We become complacent. So we still have to wear masks. We have to still maintain social distancing. We have to manage it like an endemic till the vaccine kicks in, because I think we are in this for a long haul. None of us expected last March that it is going to go on this long. But again, throughout 2021, we have to learn how to manage it. And so, and also I'm interested in the serosurvey results for Kerala to see that, probably like Mumbai or Delhi, where we have seen seroprevalences of around 50-60%, Kerala has more room for the virus to grow. So that sort of tells us the lesson that we have to be like New Zealand, that unless the virus goes down to single digits and we can contact trace and contain those cases, we can never let our guards down.
And currently we have the vaccine drive, which is proceeding in India. In March, it'll open up for the, second segment of that vaccine drive. But with the cases going down, people are even asking whether, they even need to take the vaccine.
Yes, so that is a question even my parents are asking, that the case counts are down, it's not serious, should we take the vaccine? So my advice consistently has been that even if you had COVID, and in US, the recommendation is that you should take the vaccine. If you had it more than 10 days ago and you did not take a monoclonal antibody treatment, then you should take it. And even if the asymptomatic infections are large and you have antibody positive, the guidelines are that you should not really rely on this ephemeral disease-induced immunity. You should really, the vaccine-induced immunity seems to be really stronger. And new data is very encouraging that it does not just protect you against severe disease, it also reduces transmission and the chance of infection. And that's huge and goes a long way in stopping this virus. So I think that we have to really do the right messaging that all the vaccines, there are some doubt about some vaccines in India, I know, but the AstraZeneca vaccine and Covishield that has data all across the world. And I think that when your turn comes, you should take it.
I wanted to ask you about the variants as well. There are these different variants that have been discovered in the UK, in South Africa, and Brazil. It's been very, very alarming. So what more can we expect on this?
Yes, so it is natural for a virus to mutate, and there are many conflicting stories about how lethal this B117 variant is and other variants are. It's definitely true that it seems from the UK data that it is much more infectious. But I think that the old virus, the old strain of the virus, is probably protecting us against the new strain as well. So I have not heard many reports of reinfection of people who were infected with the original variant. And that also gives us hope that the vaccines are also offer some protection and generates immune response against this virus as well. So I am not overtly concerned because we have learned how to manage it. The original, 1 year ago, we were taken aback and we lost our battle initially, but now we have a lot of tools in our armor to fight the new variant as well. And it also shows that we cannot let our guards down even when we are vaccinated. Probably we're going to wear our mask and socially distance, avoid large gatherings for a long time so that we are confident that we are controlling the virus. So, and again, I think that in India and other countries where the seroprevalence in the big metros are high, probably there is this virus circulating. We should consider like genomic surveillance, but I think that the infection from the original strain is probably giving us some protection as well.
All right. Thank you so much, Professor Mukherjee, for joining us there.